I'm Dr. Nandini Hazarika. I'm a pediatric hemato-oncologist and a bone marrow transplant physician at Madhukar Rainbow Children Hospital, New Delhi, India. What I do, I take care of all the children with blood-related disorders and cancers. So that is called pediatric oncology and hematology. So it's a good thing for pediatric cancer that most of the pediatric cancers are now curable. Almost 80 to 90% of pediatric cancers are curable. The children are surviving and becoming a normal older individual and leading a normal life. But we need to diagnose them very early and give them a proper treatment-based protocol. So their treatment is little intensive, not like adults. The pediatric cancers are totally different from adult cancers. The pediatric cancers response to treatment is very high, and most of the pediatric cancers are treated with chemotherapy because they are very highly aggressive tumors. So their response to chemotherapy is very good, therefore outcome is good. But it is an intensive treatment, and it's a long treatment, the treatment sometimes continues minimum for 6 months to 1 year or 2 years of treatment. So that's why it's very important that we stick to the protocol and complete the treatment, because once we start the treatment, immediately your child will be okay, and then the parents can feel that why there is importance to continue the treatment. But it is very important so that the disease doesn't come back. So if you do not treat properly, disease might come back and then outcomes are not very good. And if we detect them late, then also the stages will be very high risk disease. So then your outcomes may not be that good, and then your treatment will be also very, very strong or more intensive, leading to more side effects. So it is important that we diagnose them early and give them optimum treatment so that you get a better outcome and the child can lead a completely normal life with some minimal long-term side effects which can be taken care of. So how do you know that your child is having cancer? So there are some symptoms which we have to be cautious. If those symptoms are there in your child, then you have to consult your doctor. Like number one is pyrexia of unknown origin. This is a medical term, but it is commonly said that if your child is having fever, pyrexia means fever, if the child is having fever for a longer duration, like almost a month or more than a month, and there is no diagnosis coming up, like you are giving antibiotics, you are going to your pediatricians, but you are not able to diagnose the cause of fever, then it is very important that there could be underlying blood cancer or lymphoma. So the commonest cancer in children is the blood cancer, and there are few types of blood cancer. Out of that, ALL, acute lymphoblastic leukemia, this is the most common type of cancer in children between 2 to 10 years of age group, we commonly seen, and it has an excellent outcome. All the low risk ALL, if you treat them properly, almost 90% of them can be cured and can lead a normal life. So therefore you should also know that what are the symptoms. So one I have said, it is that fever for a longer duration of period. Then if the child is looking pale or there is some bleeding or black spots in the body, then also it could be a sign of leukemia. Or if your child is having pain in the joints for a longer time, then also you should think of leukemia. Then if your child has headache or vomiting, so many a times the vomiting we think it is because of stomach upset, but if the vomiting continues for a longer time and child is having headache for almost a longer duration of time, then you should always think, is it a cause for brain tumor? So brain tumor also another second commonest cancer in children. Then coming to third commonest cancer in children is lymphoma. So in lymphoma, the child will have some glands, we will already have nodes in our neck, in the axilla, in the stomach also, but these glands will increase in size and the child may have fever along with the increase of the glands, or there may be weight loss or sweating at night, excessive sweating at night. So this could be symptoms of lymphoma. But in children, most of the children will have enlarged neck nodes, which is very common. which may be just because of infections. But if your neck nodes are increasing in size and it is not reducing, not getting reduced, then yes, you should consult your doctor or can get a biopsy of the node done to rule out lymphoma. So these are three common cancers: leukemia, brain tumors and lymphoma. Besides this, there are so many other types of cancers which can happen in children, like neuroblastoma, which is a very common tumor of the abdomen. We have a small gland above our kidney which is called adrenal gland. So from that, if a tumor arises, it is called neuroblastoma. It is very common. We see in children even below 1 year of age also, but outcomes are excellent. So that's why it's very important we detect them early. Then there could be tumor of the kidney, which is called Wilms tumor. Then there may be tumor of the liver, which is called hepatoblastoma. So all these tumors usually we see in a very small children below 3 to 4 years of age group. And in older children, we see some other types of cancers like bone tumors, osteosarcoma, Ewing sarcoma. There could be other sarcomas also like rhabdomyosarcoma. These are cancers arising from the muscles. So there are different types of cancers which we see from birth to up to almost adolescent age group, including blood cancer, brain tumors, lymphomas, neuroblastoma, Wilms tumors, liver tumors, then bone tumors, and also there can be tumors in the eye also, which is called retinoblastoma. Again, this is also very important that many of the children with retinoblastoma in earlier times, we used to just remove the eye. But nowadays, we are giving chemotherapy first so that we can preserve the vision. The child can see the world and you can just do some laser surgery inside the eye and preserve the eye. So this is very important that most of these children with cancers can have a normal life if we detect them early and treat them properly. So in the treatment, I have already mentioned about chemotherapy as one of the major treatments. So there is another treatment like surgery, which also is important in children with cancer. Like if they have a tumor in the abdomen, so the child will need surgery and chemotherapy. And radiation therapy, which is very commonly used in adults, is not so commonly used in children. But yes, for brain tumors, radiation is very important. And for some of the abdominal tumors, along with chemotherapy and surgery, the child may require radiation therapy. So these are the three modalities of treatment usually we treat the children with cancers. There is one more modality of treatment that is called bone marrow transplant, commonly called as bone marrow transplant, but nowadays we call it as a hematopoietic stem cell transplantation.